Good afternoon and welcome. You're listening live to Heart-2-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist here today at KMET 1490 AM ABC Radio, and along with my wonderful colleague and best friend, Dr. Robert Jaffe. We have him back here today.
Yes, thank you.
You're welcome.
So that's me. I'm Robert Jaffe. I'm a licensed marriage and family therapist. Been in private practice since 1984. Seems like a long time. I guess it is a long time.
It is a long time.
I'm here with my...
That what makes you a good therapist.
I'm here with my best friend and my colleague and business partner, Dr. Mitra Rashidian. And we're here to welcome you. We are going to talk today about areas that are near and dear to our heart. We're going to talk about relationships. We're going to talk about sexuality. We're going to talk about self-esteem. And we are here to let you know that you do contain within you everything that you actually need in order to feel happy, joyous, and free. Some of those qualities we come into the world with are, we come in very open, we come in curious. We're all very curious when we come in. We come in honest. We don't know how to lie. That's something that we have to learn. We also come in as sexual beings. We just learned recently, we're taking a sexuality seminar. We're not giving it, we're attending it. And we learned that we're sexual pretty immediately, that boys can actually have erections when they're in the womb, believe it or not. And they know that girls can lubricate as early as 3 days into the world. So that means that that's a natural function, and it's a very important part of us. That's what we're here to talk about. And we also have other qualities, some of which are we have the ability to be calm. We have the ability to be emotionally available to others and connected with others. We also have the ability, one of our great abilities is to be compassionate with other people. And we have the ability to be trusting. We can trust other people. We don't have to be afraid. So those are some of the abilities we come in with, and that's what we're here to do, share about those things. We want you to call us. We offer a free 15-minute consultation with either Dr. Rashidian or myself about any topic, and that would be offline. And we're offering that today to our fourth caller. You can phone us at area code 951-922-3532. 951-922-3532, anytime during the next hour.
Thank you, Dr. Robert, for that wonderful introduction, and it's truly great to have you back here today.
Thank you.
My pleasure. So today's session is about another favorite area of life, human sexuality, right? In looking into what I want to bring to the table today for us to discuss, I thought of my clients. What is it that mostly I see happening among them, right? And in particular on the female side, I realized that and as some of them actually say it, and some of them demonstrate it. What causes the difficulty in their sexual relationship? It starts with the relationship, and ultimately, you and I know that it ends up in the bedroom anyway, right?
Mm-hmm.
It's the feeling of inferiority, right?
Yeah.
So I like to define what inferiority actually means according to American Psychological Association.
Okay.
So that we know exactly what we're talking about, because we can have various form of definition and understanding for each term, right?
Mm-hmm.
So APA, or the American Psychological Association, defines inferiority as a basic feelings of inadequacy and insecurity deriving from actual or imagined physical or psychological deficiency, right? So one thing that was interesting for me in this description was the word imagined, right?
Yeah.
So it's interesting to see how one can imagine that they are inferior or they act like one, and then not know it. And there are some that they actually say it, that, you know, I'm an inferior person, and they continue to be inferior, right? So we want to know that what happens that somebody can imagine that for themselves, and some actually, you know, have some factual information that they believe that that's why they are.
Yeah, and I want to say that Albert Einstein said that imagination is more important than knowledge.
Than knowledge, yeah.
Because imagination is our creative ability, and we can create whatever we imagine. We're proving that all the time with these new creations. I mean, we can now. In my early years, I'm going to be 71. I was born in 1949, so 50s and 60s, you know, were my childhood and adolescence. And we watched Star Trek, where people, you know, from the future would talk into a box to somebody else that was, you know, miles away, and they'd be able to hear and speak. And that was science fiction.
Yeah.
And now we have that, right? We have a little box. We call it an iPhone or a cell phone. We can speak to anybody in the world pretty much.
Exactly.
And so that started in somebody's imagination. And so whatever we imagine, we can create. And that has to do also with our self-esteem. If we imagine that we're inferior, we believe it, and then we act inferior, and we sort of create that in reality for ourselves.
And what's interesting, what I see in therapy, is that once somebody believes that he or she is an inferior type of person, the expectation that they have also to be treated as such, right? It's like they're not familiar with any type of, any other types of treatment. They can't connect to any other types of treatment, right? And if somebody does a nice work or a kind gesture, offer a kind gesture, or even give them a gift, right? They don't know what to do with it.
Or a compliment.
Yeah. So they simply reject it as something they don't like.
Yeah, that's a beautiful blouse. Yeah. Oh, this old thing.
Yeah. Exactly, right? So how did the term inferior actually came about? It was done by this psychoanalyst Alfred Adler, that explained why so many people seem to lack the motivation to act in their best, their own best interest, and go after their goals in life. So, you know, yes, self-esteem is a part of that, right? But it has to be such a profound negative belief that one can have, right? And it needs to be such a deep-rooted belief and feeling,
right,
for somebody to act that way, and that becomes part of everyday life for them. And you can only imagine the pain and the suffering and the upset that they experience moment to moment, and as a result of that and their reaction towards everybody around them, how they can influence everybody else in a negative way, and how that can impact loving relationships. And with that feeling, anybody who goes in the bedroom, how can they be loving and intimate towards each other?
Mm-hmm. Right.
Right?
Yeah, it's interesting. You're talking about that, and I saw on a TV show. I'm trying to think of the name of the show. It might come to me, but it's not there at the moment. But it was an interview, and this man interviewed another man who was born without arms and legs, and all he had was stumps. And he would walk by putting his two stumps on the ground and swinging his legs forward. But it weren't really legs, it was just the stumps of legs.
Right.
And he would be able to sit on a chair by climbing up the chair using his stumps. And so the man who was interviewing him was saying, what was your life like, without having arms and legs? And he said, actually, it wasn't bad because my parents always told me that I could still do anything that I set my mind to do. And one of the stories that he gave was, he said, I learned to, he says, I decided I wanted to wrestle. And the interviewer said, oh my God, how could you wrestle without arms and legs? He said, well, I just figured I could climb up the guy and put my stumps around his neck and grab him tight and get him to fall down. And that's what he did. And so he actually did wrestle on the team, and he's in the first year he lost every bout. And at the end of the year, he said to his father, I'm ready to quit, because his father made a deal with him. If he tried something, he had to give it a certain amount of time before he quit. And he says he did it for a year. He wanted to quit. He lost every round. So his father then said to him, well, don't quit now, because now you're going into your second year, and you're going to be wrestling people who are coming in on their first year. They won't know what's going on, and you'll be able to beat them.
Wow.
So he said, okay, I'm going to give it one more year. So he gave him one more year, and sure enough, he started winning his bouts. Wow. And he became a really good wrestler without any arms and legs. And so that's not the end of the story. The end of the story is the man's father, the guy's grandfather, was there, and they were talking about wrestling, and the guy says to his grandfather, my father, told me that when he was a kid, he lost every bout in his first year, but then he started wrestling the second year, and he was doing a lot better because he was wrestling these new people. And his grandfather looked at him and he said, your father never wrestled. So his father made up the story, and he bought it, and he actually became successful at doing it. And we're talking about imagination,
yes.
Right? Yeah.
Yes. I mean, our imagination, for sure, has helped us evolve, right? Mm-hmm. If it wasn't for our imaginations, and it wasn't for our creativity to make what we imagine happen, we would have still probably live, so far behind than where we are right now, right? Mm-hmm. So it's the imagination that can actually help us grow, or the imagination can help us to deteriorate.
Exactly.
Right?
Exactly.
So let's talk about this more after our commercial break.
We're ready to go. Bye-bye.
For now. Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Dr. Mitra and Dr. Robert here. If you're just tuning in, our discussion for this segment is inferiority and its impact in relationship and sexual relationship. And for those of you that you are new to our program, welcome. And we would like for you to please share this program with those that you believe they can benefit from this. And we thank you for sharing your hour with us. If you are the fourth caller today, you're going to receive a 15-minute consultation free with myself or with Dr. Robert outside, this program. And then what else? You can visit us also at our YouTube at Heart-2-Heart .online/YouTube. That didn't go well.
Call us this hour. Our phone number is 951-922-3532. 951-922-3532. Free 15-minute consult for our fourth caller.
Exactly. So we look forward to hearing from you. And, please call us with your questions, with your comments, because after all, this program belongs to you. So we're talking about inferiority, and one may ask, how does it develop? How one becomes inferior, right? For that, I borrowed some concept from Erik Erikson, the father of psychosocial, psychologist, right? So he actually, Erikson has divided life stages into different categories, and according to him, at each life stage, we learn something about ourselves, which becomes part of our interpersonal skills. Right. And then we use that interpersonal skill into our relationships, and then we add to that, we develop it accordingly, depending on our experiences and what goes on with us, right? So the very first stage, he calls it trust versus mistrust. With that can generate hope in people, right? So trust versus mistrust, I think it starts from infancy all the way to almost 2 years old.
Yeah. I mean, right. these are approximations.
Approximate time frames, right. Life time frames. And then go ahead.
Oh, go ahead.
No.
Oh, well, I was just going to say, and how does an infant learn to trust or learn not to trust?
Right. I guess the basic example I can come up with is the game of peekaboo. Right. So what's peekaboo? When mom hides and then the child looks for mom, and then mom says peekaboo, and then brings her head out. So the child knows that if mom goes away to the kitchen, she will come back to her. Right. So the child learns that the world is safe, that her or his environment is safe, and there are stable people there, and then she knows that she can trust her environment or his environment.
Right, because the baby doesn't know. When the baby can't see us, the baby assumes that we can't see them.
Yes. Right.
So that the baby, when you're pulling the blanket back and forth, the baby thinks that you're gone, and then all of a sudden, miraculously, you're there again.
You're there again. Yeah. Exactly. So it's the game of peekaboo. That's how I guess it was invented.
Yes.
Right. Maybe.
And another way that trust is learned is that when the baby calls for help, that the call is responded to.
Yeah.
So.
Feeding time.
Bathing time. When the baby is, before the baby learns how to talk, which is around age 2, the baby communicates through noises and also through body language, but mostly through cries. And if the baby is hungry, the baby may cry. And if the baby is cold, the baby may cry. And if the baby is tired, the baby may cry. And the attentive parent learns how to differentiate and distinguish those cries, and so gives the baby what they need, so that the baby then starts to feel like, oh, the world is safe because when I cry, miraculously what I need gets met.
Exactly. Right? So if that stage goes on and develops healthy, and then so the nature of hope and the trust is strong in the toddler, and then the next stage of life is called autonomy versus shame and doubt. Right? So it is in that area that when a child feels safe in the world, or in his or her world, or in the environment that they are growing up, then they feel safe to kind of separate. They feel safe to explore. They feel safe to do things on their own, without fearing that somebody's going to be there to attend to their need, because they believe by now that there will be somebody attending to them, right, as they need it.
I can explore because I'm safe.
I'm safe.
Right.
And then with that, with that healthy part, they go to the next stage of life, and now we're talking about almost 3 years old, right? If I'm not mistaken, that kind of initiative versus guilt, which instead of feeling bad about what they do, right, they are supported in their actions, in their choices, right? It is that support that allows them to explore, that allows them to examine, that allows them to even make mistakes and understand from their mistakes, versus feeling shame about, what they're doing.
Yes.
Which gives them, a purpose in their life. It gives them some level of stability about their choices and wanting to move forward, right? And it is that takes them to the next stage, which is industry versus inferiority, which is basically competence, right?
Right.
How they feel competent, how they feel strong, how their self-esteem is a healthy one or a low one or a higher one, what's going on. So if we can see that fundamentally, if the other 4 stages are not developed in a healthy way, the child can become an inferior person by no later than age 4.
Yeah, well, they believe. I'm going to say they believe. It's as though they're inferior.
Right.
They don't. Right. They're not actually inferior.
Right. No, that's it. Everything is a belief. This is what we develop in our mind, and then that's what we have talked about this before, about perceptions, about beliefs, about feelings associated with that, attitudes that we develop.
Right.
So this is all in our mind, right? And then, so this stage basically is the stage that individuals believes that they have the ability to rely on themselves, right? And to rely that they can learn about various aspects of life, such as making connection. They do self-evaluation. They can do teamwork, and make educational achievements, make social achievements at the age that they are, and they feel that's where they can feel either competent to do that, or they feel that they can't do it. Right. If they can't do it, that's where eventually, if nothing is done for it, the person develops that belief that they are inferior and they can't and they're not capable, and that's how it starts. So inferiority is not something that happens, as a result of a bad marriage, right? Or a marriage that is not doesn't sound to be successful. A person has to have this feeling of inferiority in them, and then a relationship that is not successful can actually bring up those feelings.
Yeah. So the other thing that I was saying during the break is a quote from Henry Ford,
right?
Which is, if you think you can or if you think you can't, either way you're right.
Yes.
And that's what we're talking about here. And so when children, this to me brings up the big issue of punishment.
Right.
Because when you punish a child, the punishment, if you're not saying the specific thing that you're punishing them for, the specific behavior, and the child will feel not that they did something wrong, but that they are something wrong.
They are something wrong.
Right.
Yes. Yeah.
And we've also learned that punishment only works in the short term, but that really children don't really need to be punished. That children need to be praised and corrected, but corrected doesn't mean punished. Corrected just means show them the way that it would work, rather than the way that it would be harmful to them or somebody else.
Them.
You educate, yeah. And if you want the child to have high self-esteem, you don't really need to punish the child, because we're all, as human beings, we're highly sensitive to other people's feelings, other people's responses to us, and especially when we're children, we are born with our right brain, which is the feeling part of us, actually developed. And the left brain is the thing that takes a long time to develop.
That's our experiential part.
The right brain.
The left brain.
The left brain. Yeah, the left brain
is our skill part.
Is the skill part, right? The right brain is the feeling part.
Is the feeling part.
Yeah.
Yes.
And so because we're so dependent on our parents, just a look, a negative look from the parent, the child will pick up on and recognize that, oh, I'm doing something I'm not supposed to be doing. You certainly don't need to raise your voice, and certainly don't need to ever strike a child. However, today, I mean, we're in the process of evolving. The world is evolving, and the world hasn't really known what we're saying right now. So there's still a lot of people today who subscribe to the idea of spare the rod and spoil the child, as though punishment is justified, and we're here to say that it isn't.
Yes.
Yeah.
It is not. You know, there are some psychologists that they associate, instead of saying inferior, they call it low self-esteem.
Mm-hmm.
Right. However, you know, what I see myself in therapy is that inferiority, I think, can cause low self-esteem. So I can't just say inferiority is equal to low self-esteem.
Yeah, explain that a little more.
So
when you say inferiority, you mean the belief that you're inferior?
The belief of inferiority.
Okay,
yes.
That's different than inferiority.
Yeah, yeah. The belief of inferiority can cause, you know, low self-esteem in a person.
Yes.
Right.
Yes.
But the fact that somebody may, you know, it's low self-esteem not necessarily means the belief of inferiority, because the low self-esteem can happen as a result of other factors.
So give me an example of low self-esteem that is not related to inferiority.
So, for example, let's say some child is participating in a competition and he or she doesn't win the trophy.
Yes.
Right. As a result of that, momentarily they may think, oh, I'm less than my team member, or I'm less than this other group, and I should have won. And so they kind of become self-critical of themselves, and that during those self-critical moments, they're not going to feel good about themselves.
Yeah.
But in the next competition, they're functioning fine, and they are motivated to go for the next competition.
I see. I see.
Right.
So the fact that they lost the competition means that, well, I'm still not clear, because if they lost the competition in the moment, they're not going to feel good about themselves.
Right. So that may create some low self-esteem, and then they can temporary, and then they can have negative self-talk and negative emotions. However, that event doesn't take their motivations away from them for participating into other competitions.
Right.
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 So then they're not inferior people or persons. Because
so are you saying then that inferiority means that you have a more of a permanent sense of low self-esteem?
It's not permanent, but however, I think it's a contributing factor to more profound low self-esteem that we see in adulthood.
Okay. Yeah. I think of self-esteem as many things.
Yes, it's many things.
Yeah, well,
yeah, self-love is one of it.
Well, yeah. So, but you can have, let's say, high self-esteem in terms of your artistic ability, and low self-esteem in terms of your mechanical ability.
Right.
Right.
Right. I have low self-esteem in my writing, but I'm a fantastic artist.
Right. That's your belief.
That's my belief.
Right.
Yes, exactly.
Right.
Yeah, but that doesn't make me believe that I'm an inferior person.
Right. Right. Yes.
However, somebody who believes that he or she is an inferior person, they apply that in most areas of their lives. Right?
I see.
And one area that I see that happening, it is in their sexuality. And I see that in their romantic relationship, right? And there are some signs and symptoms that we can share to see how that actually happens, right? And also, both self-esteem and inferiority do develop from childhood, right? So I can see that kind of parallel to each other, and some point they can cross each other.
Right.
So that happens. However, like I said, I don't believe having or experiencing low self-esteem necessarily has to do with believing that one is inferior.
Okay. Okay.
Right. So
Yeah.
I would say that inferiority happens first before low self-esteem. And this is what I see. So, and then it doesn't mean that certain people can have the experience of inferiority in them. We all, from time to time, we can have such experience. But the type that is really a concern is the one that stays permanently with the person, right?
A permanent feeling of inferiority.
A permanent feeling of inferiority to the point that one can actually introduce herself or himself as, I am an inferior person. I know that. I believe that. This is how I function.
Right. Right.
That's a profound feeling of despair. That's a profound feeling of, unhappiness.
Right, because there's nothing you can do about it, because you believe it's just the way you are.
It's just the way you are, exactly.
So nobody can ever convince you otherwise.
Right.
Yeah, absolutely.
Yeah. So more of this after our commercial break.
After our commercial break.
Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Our phone number here is 951-922-3532. Please call us. If you're the fourth caller, you're going to have 15 minutes free consultation offline with either myself or with Dr. Jaffe. So thank you for listening to our program this afternoon. We are talking about the concept of inferiority, believing that one is inferior, and how that impacts, their relationship, romantic relationship, and their sexuality, right? So here are some of the what somebody who believes that they are inferior actually do. So they constantly focus on thoughts that they are upsetting, right? It just becomes so normal to do that they may even not know that besides focusing on upsetting feelings, there is actually some other things to discuss. They actually don't get any pleasure focusing on happy thoughts. But they are more comfortable in their upsetting thoughts that, I can't do this, nothing works for me, no matter how much I try, it's not going to happen. So why bother, things like that, right? No matter what I do, he's not going to get attracted to me, or, I'm the way I am, I'm simple, but, I'm not measuring up, and that's who I am, and that's how I am. So they're more comfortable focusing that way versus having the desire and motivation to sort of change some of that and see, well, let me see what else is there.
Yeah, so I think what you're talking about is, for me, it's bringing up the idea of whether we are more pain avoidant or pleasure seeking.
Right.
So if we're very pain avoidant and we don't think that we can do something, then we're not going to try, because the idea of trying and failing is too onerous.
Yes.
Because the whole idea is to avoid pain as much as we can.
And that's the pain of failure.
That's the pain of failure.
Yeah.
And not only, but it's not actually the pain of failure, it's the pain of how you treat yourself when you don't live up to the expectation that you've set for yourself.
Right.
There actually is no failure period in life until you stop trying to do something. So if I try to start a business and the business doesn't work, I can say I'm a failure at starting a business, rather than, I tried to start this business and that didn't work. What can I learn from it? And if I still want a business, I'll try something new, which means that I'm more pleasure seeking than I am pain avoidant. Because obviously starting a business and not having it work out the way you want, it is going to be disappointing. So I'm going to avoid the disappointment rather than seek out something that can work, because and usually that's because we've been exposed to so much pain.
Right.
Right. The whole thing to me, a lot of it comes down to our parenting style.
Absolutely, yes.
And the more that we give our children positive affirmations about what they're doing right, um, and simple alternatives to when they're doing something that we think they could do differently or better. Well, you can try it this way, honey.
Yes.
You know.
No, you're absolutely right. I mean, and I see that also among couples who one member or both either coming from a divorced family or adopted families at a very young age, which that for some, depending on the parenting style of step parents, right, can give them the feeling whether that if they were good enough, their original parents, their prime parents, wouldn't have put them for adoption or wouldn't have gotten divorced.
Right.
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 And so we see that the feeling of or the belief of inferiority is really deep rooted. It really starts right from the beginning of life almost.
Right.
Depending on how the parenting is, and then with respect to what you were discussing, there is a profound feelings of shame and guilt and embarrassment
when we're being punished.
Right. Right.
In general, when we're being punished, but also specifically when we're being punished unfairly, or from our perception it's unfair,
right,
or when the punishment is severe.
Right.
And unfortunately, we still live in a society and a culture that believes that punishment is how we should treat other people. People who go to prison are not treated as human beings a lot of the time. I can tell you that one of my relatives was in prison and had a toothache, and kept complaining that he had a toothache, and the prison guards didn't do anything, and eventually he passed out from the pain. And when he woke up, he was in the dentist's office, the prison dentist's office. And the dentist said to the prison guard, "Well, you almost killed him," but that's just one story that this person told me about what happened to them in prison.
Yeah.
And that has to do with our belief that people who break the law should be punished. We give lip service to the idea of rehabilitation. There are some good programs that are focused on rehabilitation, but for the most part, people still want to see people who break the law punished.
Punished.
Yeah.
Yes.
And that affects our philosophy of child rearing, and as a result, we don't allow people to say, yes, I made a mistake and now I'm learning.
Exactly. Yeah. It's a very deep negative emotion and feeling, and people who experience that, and they also may feel responsible for other people's failures and shortcomings. Right? If somebody's business within a couple, if the husband's business doesn't become efficient enough or successful enough, the wife who may believe that she's inferior may feel responsible for that. I didn't do something, or I did something that didn't work, or I should have made a different contribution, or I shouldn't have made that suggestion. So there is never a right place, a balanced place for them to be in terms of their feelings. Right. And then the sense of controlling can actually develop as a result of that. I'm inferior person. However, if I manage this, if I control this, if I take over this, and to the level of extreme, and to make people actually follow their plan, right? That's another aspect. However, the big umbrella feeling is that I'm not good enough.
Yeah. The other thing I want to mention is this whole idea of punishment. Helping people. We don't really know that not punishing people helps them, but it doesn't. Not punishing people does help them. So educating people Um, and that has to do with who we believe the person to be. People tend to live up to or down to the expectations that are placed on them. So if the person believes that they are worthy and good and honorable, and they are treated as such, they become more of that.
Right.
If they believe, if they don't know whether they're worthy and good and honorable, and and what's placed on them is that they are not, then they tend to live down to that.
Right.
And that affects what we're talking about now. That affects their self-esteem. There's a tribe in Africa called the Mabenga tribe in Central Africa, and when someone breaks one of their rules, there's several hundred people in the tribe. When someone breaks one of their rules, steals something or harms someone, they isolate that person and they put them in the middle of the tribe, and everybody stops working, and they surround this person. And each person who has known this person who broke the rule goes up to the person and speaks at length about all the good qualities of the person, about all the positive things that they've seen the person do in their life. And since there's only a few hundred people, everybody pretty much knows each other, and they can spend several days going through this whole ritual where they're talking only positive things about the person.
Right.
And then at the end, they say, we know this is who you really are, and we know that you forgot for a moment who you really are, but now we want to welcome you back into the tribe.
What a nice approach.
And
wow.
then they break the circle, and then they all have a big celebration and a feast where the person is literally and figuratively welcomed back into the tribe.
Wow. Such a big difference.
Yeah.
And if that person, certainly will get enough motivation to go back to where he or she needs to be in life.
Well,
right?
Someone said to me, well, you're shaming the person by telling them that. And I said, well, there may be an element of that, but they're not really doing it to shame the person. They're doing it to remind the person of their innate goodness.
Right.
And each person carries that within them. And the reason that we do things is because we've forgotten that, and fear takes over. And when fear takes over, then we act in ways that are not kind or gentle or loving to other people.
Exactly. Yes. And speaking of kind to other people, as part of feeling or believing that one is inferior, in particular in women, which we see is the act of jealousy.
Mm-hmm.
So they can become jealous towards even and a stepdaughter. They can become jealous even to an in-laws. They can become jealous even to their children if the spouse is paying attention to one child more than the wife does.
Yes.
Right. So we see that, and then because of that jealousy, they can make suggestions that they are not applicable. They can make decisions that they can be detrimental. However, all of that comes down to the point of, I need attention. I need to get your attention.
Mm-hmm.
Right? Mm-hmm. Your attention needs to be all on me. So that sense of controlling can lead into become perfectionist, and that leads to can lead also include jealousy.
Yes.
Right. So it's an area in life that definitely we see that it causes conflict in relationships. And then when there is jealousy and the perfectionism and the sense of control, how can two people feel intimate towards each other? Right.
Yeah. The last thing, I think we're almost out of time here, but the last thing I want to say is, when you were talking about, feeling a feeling of one down, a feeling of inadequacy, a feeling of failure, those roles often take over in relationships.
Right.
And one person is the person who's dominant, and the other person, it could be man or woman. It's not necessarily a sex thing, but the other person is the one who gets dominated, and as soon as the one who gets dominated starts to say, I don't think this is fair anymore, it causes a big rift in the relationship.
Exactly.
Yeah.
Yes. So there's a lot to talk about, inferiority, the belief of it, the practice of it, the experience of it, the belief that this is who I am. It's detrimental to the individual's mental health, physical health.
Mm-hmm.
It's detrimental to the relationship, right?
Yes.
It can actually cause a divorce, causes a breakup, in particular when it gets to the point of perfectionism and to the point of jealousy and sense of control,
Mm-hmm.
right? So these are some of the factors that we see it causes, problems within marriage and, sexual relationship. So I like to even actually continue with this for our next time.
Okay.
Right, to get more in depth into the understanding of how this concept can make us or break us in relationship very much.
Yes.
Right.
Absolutely.
And then it doesn't just stay with us. This is also a feeling that we can project into our children,
mm-hmm.
and make them, believe that this is life, right? So I guess we are at the end of our program, and please don't forget to join us tomorrow morning at 9 o'clock for another episode of Relationship Addictions, Codependency and Trauma with Dr. Jaffe and myself. And until then, don't forget, all you need is love.
All you need is love.
Have a wonderful evening.
Keep up the love.
Keep up the love.